Welcome to the third video in a series of 10 called Schizophrenia Demystified. I'm Dr. Linda Snow-Griffin, a retired psychologist and the mother of a son with schizophrenia. The question addressed in this video is, can schizophrenia be cured? The answer is, most of the time, individuals with schizophrenia can now learn to manage their symptoms or be completely symptom-free, which is phenomenal news for many who have schizophrenia in this day and age. But this has not always been the case. In the past, if someone was diagnosed with schizophrenia, he or she could expect to spend months or years in institutions. Personal and professional goals had to be abandoned, and life was interrupted without any chance of recovery for most people. Between 1900 and 1950, before the discovery of the antipsychotic medications, medical treatments were often unreliable and dangerous, such as pyrotherapy, which involved injecting strep, tuberculosis, or even malaria pathogens to create a fever. Most interventions were used to control behaviors such as coma therapies, ice-cold baths, electroshock therapies, and lobotomies when part of the brain is surgically severed. With the discovery of Thorazine, psychotic symptoms improved, but the side effects of early medication was often heavy sedation, tremors, and uncontrollable muscle movements. Gradually, over the past 50 years, this picture has changed. Thanks to both medical and psychosocial research, medications and treatments have improved. During the past 22 years since my son was diagnosed with schizophrenia, treatment has made even greater leaps. With the advent of the newest types of medications, many people with schizophrenia can manage and sometimes find total remission from incapacitating symptoms. Most still need to take medication, like those with diabetes often need to take insulin. New psychological approaches now use strength-based treatments and work with many aspects of a person's life that are important to recovery. Those with schizophrenia can now learn stress management, cognitive behavior therapy, and skill-building tools, and receive employment counseling, substance interventions, and help addressing physical health care. Families can also be an important part of the treatment and learn ways to help their loved ones. Most importantly, there has been a paradigm shift, a whole new way of looking at treatment. People with schizophrenia can now be active partners with psychiatrists and psychologists in creating treatment goals and selecting interventions that will help them most. Because of these new discoveries and directions, many people with schizophrenia are able to live independent and productive lives. That doesn't mean the recovery process is easy and that everyone is able to resume life the way it was prior to the diagnosis. According to the American Psychological Association's Recovery to Practice program, it does mean that most people with schizophrenia can now achieve the 4 goals of recovery: personal health, having access to good medical care, eating well, occasionally exercising; a stable home where they can feel safe and secure; a sense of purpose, meaningful work or activity, being able to make a contribution; and community participation and support, having friends and family that you enjoy spending time with. Fortunately, my own son has finally reached recovery goals. He lives independently with his wife, he enjoys his job, he has a nice home, and he spends time with family and friends when he's not working. But he is not alone. Dr. Harding reviewed and published worldwide studies that indicated the recovery rate from schizophrenia ranged from 46 to 84%. These numbers indicated full recovery as well as symptom improvement. Other research supports the idea that each decade following initial diagnosis, the chances of recovery continue to improve. Yes, there are people that still struggle even with good treatment, or many people that may refuse treatment or not have access to good treatment. There is still more work to be done, but now living in the 21st century, we have science on our side. So, what kinds of treatment interventions work best? Watch my next video to find out. You can also visit my website, lindasnow-griffin, phd.com, for more information. If you have any questions, my contact information is on the website. Thank you for watching this video, and be sure to watch the next one about helpful treatment interventions.